So the next thing we're going to be looking at is the electronic integrated disease surveillance system. Again, you can Google it, literally. And when you do Google it, you see that all your nurses and physicians are lying to you.
Oh.
Let's Google electronic integrated disease surveillance system and click on images. Once again, there are lots of images, but I would like to bring your attention to this one in particular. So we're looking at figure 1. We have to keep in mind that these are international systems, so they operate in very similar ways in every single country in the world. At the patient visit, the data gets logged into 2 different databases, the National Infectious Disease Surveillance and the National Health Insurance Claims-Based Surveillance. For mandatory reporting of infectious diseases without delay, you can see that it goes to diagnosis, report, online reporting system, and the end user, which is data collection and analysis. For payment with review of medical care costs, the information gets sent to medical utilization, the claim, review for claims, all the other people who review it, and even the automatic review, and then the end user, which is data collection and distribution. So with all these systems set up in place, are you really trying to tell me that the nurses, doctors, physicians, people who work in the ER are not familiar with these systems and are not familiar with where and how the data is being transferred? We really need to start having open, honest, and intellectual conversations about this. Because where I'm standing from and all the research that I've done and all the documents that we are reading, there is no way that all these people go to work every day and don't even know what they are doing for a job and what they do for a living. Now let's go back to Google and click on this link. Electronic Integrated Disease Surveillance System. And as you can see, this is a .government website, so it's an official government website. The Electronic Integrated Disease Surveillance System is a software system which is designed to strengthen monitoring and prevention of human and animal diseases within the One Health concept and facilitate compliance of International Health Regulations 2005. Key system modules include human cases, vector surveillance, laboratory, outbreak, administrative, and analysis visualization report module with geographic information system capabilities. EIDSS manages case data, case plus disease-specific investigation, aggregated data with corresponding sample, and laboratory data linked to cases. The system collects and distributes data, notifies on the events in near real time, provides access from desktop, web, and mobile devices, which allows it to link together different levels and ministries of National Disease Surveillance Network in a secure way. EIDSS is customizable for each participating country to hold relevant content, diseases list, specific reports, disease-specific investigation forms, among others. In 2011, EIDSS was introduced in Ukraine with installations at the following sites. To date, EIDSS has undergone several iterations: alpha version, beta version, version 1, 2, 3, and 4. Currently, EIDSS version 5 is ready to be implemented, and version 6 is under development. EIDSS was localized, introducing a Ukrainian language interface and relevant geographical data. EIDSS is a turnkey solution. Implementation includes deployment, personnel training, and support. The training program includes basic computer training for users with limited computer skills and in-depth EIDSS training, which includes epidemiological and laboratory modules. EIDSS is supported by a multi-layered technical support team, including a help desk hotline and support specialists based in Kyiv and Moscow. The beneficiary of the Technical Assistance Project is the Ministry of Health of Ukraine. The main objective of the program is to implement EIDSS at the sites of the State Sanitary Epidemiological Service of Ukraine for monitoring and outbreak prevention of diseases, including those caused by especially dangerous pathogens. So let me get this straight. They have a war going on. but their help desk hotlines are based out of Ukraine and Moscow? Interesting.
So yeah, your nurses and physicians are literally lying to you about what they do for a job.
Everyone, they're all lying to us.
Well, I think it's kind of split a little bit. So I do think
Okay.
there are people that know what they're doing. They know their industry very well. But I also think that unfortunately, a lot of them have already been augmented. So they kind of don't have that capacity to fully grasp the bigger picture. Like they know what they're doing,
Yeah.
but it's also sold to them that like this is good, this is healthy,
Oh,
this is going
wow.
to save
Right.
us. So their perspective of it is not really the entire
Bad or
picture.
worse. It really
You know, it's only what they had brainwashed them or what they want them to see.
Okay.
Because obviously, in order to be a nurse or to do these jobs, you have to have some type of compassion towards
Of
people.
course, that's what I.
You're
yes.
going to be dealing with people all day.
Yeah.
Right? So I think that's how they pick on the vulnerable. They're like, oh, these people are compassionate, so let's just tell them that you're saving lives. And you're going to be excited, obviously. You know, if someone told me I can go save lives, I would be extremely happy about that. I want to bring some good to this world.
Yes.
So I think that a lot of them just genuinely don't know and don't understand the bigger picture of these systems. And they don't get that, like, they don't see the engineering side of it. Because they're so busy learning, you know, their job and what they need to do, they don't see everything else that's done behind of what they're doing. You know, they just see what they're doing.